Afternoon, everybody at ET Health, and being a special day today, Women's Day, I'd like to salute and greet all the women of India and globally. May we empower ourselves to make this world a better place to live in. Today's topic is going to be restricted to our health, your health, and women's health in general. What are the factors that we should keep in mind? What impacts our health at different stages of our life, when we are children, as we are growing up in our teens, as we face our reproductive years, then in our menopausal age, and later on in the golden years. A woman is considered a caretaker to everybody else. She looks after her family, she looks after her parents, she looks after her husband, she looks after her children. She looks after everybody else. She looks after her pets at home. But most importantly, she forgets to look after herself. She may remember to look after herself, but she doesn't have the time. Working between a career, the house, the in-laws puts a lot of pressure on all of us. And I think we cope very well. But sometimes at the expense of our health, both mental and physical. A woman or a child, when born, is blessed with and born with about 500,000 eggs. You think, oh wow, 500,000, that's a lot. Unfortunately, a woman's reproductive health stops around the age of 40, and then as her biological clock slows down, and finally the tick-tock comes down to tick-tock. There is a slowing, and she may suddenly find that she cannot have a baby. It's very important for all women in the reproductive years to protect their reproductive health. There are prophylactic ways of doing it, there are physical ways of doing it, and there are curative ways of doing it. Just to give you a little background, infertility affects about 10 to 12% of couples all over the world, being the same figure in India. There are many factors that affect a woman's fertility. In today's talk, I want to focus on a woman's reproductive health vis-a-vis her eggs. As I told you, the biological clock slows down and finally stops at the age of 40, 41, 42, when the woman sees her menopause. There is a lot that you may be reading and hearing about freezing eggs. Would that stop the biological clock? Well, it wouldn't stop it, but there are ways of slowing it down. Today, we as women have the option of freezing our eggs. I always tell my friends' children, if you are 30, don't waste time. If you are going to delay childbearing and delay getting married, and if you've not found the right partner in your life, at least take the time off to freeze your eggs. Because if you freeze your eggs at 30 and decide to get married or decide to have a child at say 35 or 36, you will be your own egg donor. You will be saving your eggs at a much younger age. These eggs will be genetically more strong than those which are taken at say the age of 35 or 36. For career women, we have the choice of freezing eggs. And over the last few years, we at Jaslok Hospital have had the opportunity to freeze eggs of many women from different walks of life, where they've had the opportunity to freeze their egg. A word of caution though, egg freezing sounds very easy and very instantaneous. Well, it's not a single procedure. It is a process. It involves doing IVF. It involves taking injections. It involves being monitored by the IVF specialist. Then it involves a mild procedure under anesthesia, which is not painful. The eggs are gently taken out. They're incubated in the microenvironment of the incubator, and then they're frozen. Many women approach me at the age of 38 or 39. Saying, doctor, I have not yet found my partner, but I would still like to have a baby and I would like to freeze my eggs. up until the time that I'm ready to have a child. Sometimes the age of 40 is a little too late. It may be worthwhile to come a little earlier, because by 40, the number of eggs that we get may be much less. The right age to freeze is between 28 and 35. We need at least 15 to 20 eggs to be frozen in order to ensure that you can have a baby later on. So today, what is possible? What are the possibilities and the distinct possibilities? We can freeze eggs, we can freeze ovarian tissue. This is sometimes done when we need to preserve the reproductive potential of a woman who is faced with the problem of having cancer. Sometimes the time is not right for her to wait because the chemotherapy would start very soon. Here, women have the option of either quickly freezing her eggs, or they would have the option even of freezing parts of her ovary. Then we have the ability to freeze embryos, the ability to freeze sperm. An interesting fact, the first time that human sperm were frozen was way back in the early 1950s. Experiments with sperm freezing started with using sperm of bulls and horses, and finally scientists were able to freeze sperm. It's also possible to freeze testicular tissue. Men would have some of their sperm either frozen or in conditions where there is a very small amount of sperm available, or there is a possibility of undergoing chemotherapy. In cases where the men have testicular cancer, it's possible even to freeze testicular tissue. As I mentioned earlier, even parts of the ovary or the entire ovary can be salvaged and frozen. Many births all over the world have been reported not only with egg freezing, but also after freezing slices of ovary and also after freezing the entire ovary. In fact, even natural conceptions have occurred after ovaries have been frozen and then re-implanted into the woman. So now we've looked at some of the reasons, and I can tell you that there is a growing need for egg preservation. One is, as I talked about, to defer reproduction to a later date. Eggs sometimes are required for women who have depleted all their eggs, and therefore they have to seek the help of egg banks and donation programs to restore their fertility. Egg freezing is very important for cancer patients, and there are some sects and communities who have ethical and moral issues with freezing embryos, but do not mind freezing eggs and sperm individually. Embryo freezing is done routinely in all good IVF centers, and there are lots of uses of embryo freezing. One can freeze extra embryos after an IVF attempt for future attempts, and freezing of embryos prior to chemotherapy in women who are married and have a partner is a very well established technique. However, as I mentioned before, young women who are undergoing cancer therapy sometimes would not have the ability to have embryos frozen, and hence can look after themselves by freezing their eggs. One has to be very careful while doing the egg freezing, because this requires stimulation of the ovaries, and there are certain tumors, particularly of the breast or the ovaries, which are very sensitive to estrogen. So the doctor has to balance out the risks versus the benefits of egg freezing. Now, this is a lovely cartoon that I love very much and which is hung in my bedroom. This is given to me and Rajesh, my husband, by Hemant Morparia. Hemant is not only a doctor, but he's a very famous cartoonist. Hemant sent me this painting one day saying, Firuza, look at all this. There are so many cards on Mother Days. This little girl is confused. She's been born through surrogacy and her mother has used donor eggs. So she's wondering whom all to send the card to. So word about surrogacy. Surrogacy actually is not a social fashion. Surrogacy is actually very much a part of IVF. There are women who have either lost their uterus, either through hysterectomy, or women who have had severe scarring of the uterus because of tuberculosis. There are women who have high diabetes, high blood sugar. They have hypertension and therefore cannot carry their own child. There are women who have multiple miscarriages or who have had preterm labors, to whom surrogacy becomes a very viable option. Surrogacy is here to stay, and in my opinion, it should be offered where there is a need. We are always told when we were growing up by our parents, sleep 8 hours a day, eat food. How many of you girls feel that your mothers are nagging you, telling you, okay, don't watch movies at night, get up early, sleep early? Actually, I keep doing that to my daughter and she certainly doesn't like it. But the reality is that there are many factors in our lifestyle which contribute to infertility. There are work pressures. We are always working on deadlines. There is pollution all over us. It is in the food we eat, in the air we breathe, in the water we drink. It is everywhere. Pollution today is ubiquitous. How many of us really get sleep? Is there anyone in the audience who says, today I got my full 8 hours sleep and I'm feeling so fresh? I rarely get a chance to sleep for more than 6 or 6.5 hours. It's very important to exercise. Exercise plays a very important role in our well-being, which I will allude to later on. Drinking alcohol in moderation is fine, but binge drinking can take its toll. There is a very important factor which is hitting all of us, men and women, and that is radiation, which I will talk to a little later on. Today, there are so many gyms and places where people can exercise. Even offices will have their own tiny gym where colleagues are asked to use the gym to work out, even if it be for about 15 to 20 minutes. There is a lot of truth in the saying that even if you exercise or walk for 20 minutes a day, that is adequate for your well-being. Obesity forms a very important role, and it plays a very important part in infertility. There are many studies which have shown that women whose BMI is more than say 32 or 33% may have difficulty in conceiving. Where there is gross obesity, it definitely has a role in not only bringing down the chances of fertility, but also in having miscarriages. On the other side, at the flip side of the coin, if you see, if women are very tiny and if they do not put on weight, or if they exercise intensely, that can make them also have difficulties in conceiving because it can prevent them from ovulating, a condition called anovulation. We have always heard of Olympic swimmers, rowers, bicyclists who, when they exercise for hours and hours, sometimes they have anorexia or they want to have anorexia, and then the entire menstrual cycle stops, their ovulation stops, and they may become infertile for a while. If there is a very strong negative energy balance, again it can cause a problem. But all in all, look at this cartoon. Look at this man who is very healthy, more than healthy, as people have a euphemism for people who are on the fat side. They walk into a clinic, they lose their weight, and this young dynamic man now has made his wife pregnant. Fantastic. When you try to lose weight, it's always on your mind. When you get up, you say weight loss. When you're eating, you say say weight loss. When you're sleeping, you say weight loss. But that is true. The three very, very important sayings are weight loss, weight loss, and weight loss. There are many, many means to weight loss to get that to that end. Some will exercise, some will diet. But all in all, a healthy diet, which is balanced in carbs, proteins, fats, would be very important to sustain. I'm sorry for this interruption, but the slides don't seem to be moving. But we will now touch upon another topic where there are a lot of young girls, adolescent girls, girls who are teenagers, working girls, girls in their careers who are faced with this dilemma of polycystic ovaries. Now, what does polycystic ovaries mean? Polycystic ovaries means that there are tiny follicles in the ovary. There are multiple follicles where the ovary does not ovulate, and therefore there is anovulation, irregular periods, sometimes very heavy periods. A woman may be diabetic or pre-diabetic. There is increased cholesterol. There is hirsutism or excess of hair on the body, and a woman may be faced with infertility. Polycystic ovaries today is quite a common diagnosis. There are so many young women, when they go to the cosmetologist or to the physician or to the gynecologist, I said, oh, you have polycystic ovaries. One has to be very careful in this diagnosis. Just having cysts in the ovary and have a little hair on the chin does not make a person have polycystic ovaries disease. In any case, once the doctor makes a diagnosis, it may be worthwhile to manage polycystic ovaries well. There are immediate issues which need to be handled. Those would be to regulate periods, which can be done with oral contraceptives. There can be periodic progesterone withdrawal, and most important again is lifestyle modification. This would include eating food which are of a low glycemic index, considering weight loss, exercising, and a drug or a medication called metformin is a very important medication, not only in reducing weight but in also bringing down the insulin resistance. And metformin usually is given in a dose of 500 milligrams twice a day. Scientific research has shown that if a person even loses 5 to 10% of body weight, then the cycles of anovulation will go down, the woman will get a period, and she may even conceive naturally without taking any medication for ovulation. Of course, if somebody cannot conceive, then they can always consult an IVF specialist where we can treat them with medications such as clomiphene or maybe even injections, use in intrauterine insemination, or even consider IVF. course, there is also a lot of data which shows that women who have PCOS and who also have obesity have a higher risk of developing type 2 diabetes and risk of cardiovascular disease. So PCOS is a general health disorder in young women. It has a potential for reversal, mind you, of some of the associated risks if one diagnoses it early and treats it early. The most important thing in treatment of lifestyle is to look at modification of lifestyle with weight loss, exercise, avoid tobacco, correction of lipid abnormalities, use of metformin, and what the metformin will also do will bring down the insulin resistance and help in weight loss. So, as I was reiterating, one of the immediate issues would be to tackle the lifestyle, to try for reducing the body weight using clomiphene and hormone injections all the way to IVF if required. You know, whenever we are sleepy, when we are thirsty, when we get up in the morning, we'll start our day having a cup of strong coffee. How many times have we told ourselves, you know, if I have a cup of hot, strong coffee without milk, without sugar, I'm sure to wake up and I'll be more efficient. However, there are a lot of studies which have shown that excessive consumption of caffeine can prolong the time to pregnancy, what is called as TTP, time to pregnancy, and it can also affect the health of the developing fetus. That's why pregnant women are told to refrain from having coffee. Coffee can also affect a woman's ovulation. There are studies which show that if a woman consumes less amount of coffee, she's more likely to become pregnant than somebody who does take more than 3 or 4 cups of coffee. And another study has also found that increased caffeine consumption can be a risk factor for not achieving a live birth. A live birth meaning that the baby would be born at term and would be alive. Let's talk about use of alcohol. Whenever we are at a party, people will toast to our health, saying, let's toast to your health with a cup of champagne, a glass of champagne, or a glass of wine. Now, alcohol, particularly red wine, because it contains an ingredient called resveratrol, which has been shown to have some antioxidant effect, is supposed to be very good for the heart. But there are so many studies today which show that excessive alcohol can in fact have negative effects, and it can cause cancers and other lifestyle disorders. So I would say alcohol in moderation is good, but alcohol on a daily basis or alcohol when a woman is pregnant or trying to conceive should be deferred from. And there are very many ways by which alcohol affects fertility. Nobody knows for sure. But in men, excessive alcohol can cause lack of libido, impotence, and it can also affect sperm quality in the long run. Smoking. Smoking is a definite no-no for both men and women. Smokers are more likely to be infertile even if they have just 3 or 4 cigarettes a day. And if the husband smokes or if the male partner smokes, a woman will be inhaling. She will be having what is known as secondary smoking, and she would probably take a longer time to conceive. There are many studies which show that smoking increases the risk of low birth weight, that is, the babies are born at a smaller birth weight. One interesting study shows that women would reach menopause, women who smoke would reach menopause at a much earlier age. What smoking does is perhaps causes direct damage to the DNA of cells, particularly of the egg cells and the sperm cells. There is one study which is a little alarming, which I want to draw your attention to. Men who smoke very heavily can give rise to the children can have leukemia, and it can also reduce the reproductive lifespan of their daughters. So all you men who smoke, please give a gift to your children. Vitamin D is called the sunshine vitamin because it comes from the sun. Now all of us, if you were to do your vitamin D level today, all of us, if we are not taking replacement, would be deficient. A severe deficiency is when the vitamin D3 level is less than 10. Moderate is when it is less than 20. About 30 is average. You would be said to have good replenishment of your vitamin D storage in your body if your vitamin D3 levels were around 50. Just as having low vitamin D would be harmful, having vitamin D greater than 100 is toxic to the body. So one should be very careful that the vitamin D levels in our body doesn't go beyond 85. A value of 50 is good. Vitamin D or a lack of it is implicated in many disorders such as diabetes, obesity, cardiovascular disease, and can also contribute to infertility and poor pregnancy outcome. In our IVF program, before we start a cycle of IVF, we ensure that the woman has been replenished with vitamin D. Vitamin D is very easy to take. Just open up a vial which contains 3 lakhs of vitamin D. There is no need to take an injection. You can just mix it with a little honey and gulp it down. It doesn't taste bad. I have done it many times. Vitamin D is important in transferring calcium to the baby in the 3rd trimester. And it is worthwhile to measure women's vitamin D when they're planning a pregnancy. I've just made a little chart, or rather I have got a chart which shows you what are the things that we need to keep in mind. This is to summarize the talk. The things that contribute to our health and to keep our health in a positive balance are weight, which should be in moderation, exercise, good sleep, avoid pollution, avoid smoking, do not use recreational drugs, and avoid excess of caffeine. Now sleep. I just talked to you about sleep earlier. All of us need sleep in order to wake up fresh and do all our chores the next day. Sleep is actually, when there is deprivation of sleep, the entire cycle of our hormones, which is dependent on a circadian rhythm or a circadian clock, which is present in our brain, is disturbed, and this can have an impact on many hormones in our body, such as prolactin, such as steroids, cortisol, and even the pulsatility of reproductive hormones such as FSH, follicle stimulating hormone, and LH, luteinizing hormone. It has been shown that men and women who don't sleep well or sleep very little have fertility issues and can have decreased libido. So men and women, try to sleep more in the bedroom so that you can have a healthy sex life.
You have got a couple of questions.
Yeah. One very important fear that is there in everybody's minds and which you are worried about. And I keep telling my children to avoid putting the phone near their heads when they sleep, to avoid putting the laptop on their laps. It's evident, and there is some degree of research which shows that too much use of mobiles can cause radiation, can increase the oxidative stress in our body, can have an effect on sperm. Research is still looking at the connection between electromagnetic fields and fertility. There is no solid evidence yet, but there is sporadic research to show that excessive radiation from mobiles could cause diminishing sperm counts. There is one topic which I definitely want to touch upon and which is very important for both men and women, and these are endocrine disruptors and the impact that they have on reproduction. We live in a world where there are so many man-made chemicals. Some chemicals which are not even heard of 50 years ago have today become a part of our daily life. We are exposed to chemicals, metals, which are now ubiquitous, present in avoid any. Now, why are these called endocrine disruptors? There are many chemicals which actually combine with the cells in our body, particularly the germ cells, that is those cells which are present in the ovaries of women and the testes or the sperm producing cells in the man. And when they combine with these cells, they disrupt the normal hormones and the normal endocrine system of the body. Hence, they are called endocrine disruptors. They interfere with the synthesis, secretion, action, and elimination of these hormones. Most of the times, these are exogenous chemicals, and they definitely interfere with different aspects of hormone action. You'd be surprised. Endocrine disruptors are found in plastic bottles, food cans, packaging material. Even the receipt that you get from your ATM is coated with bisphenol. Then things like toys, cosmetics, pesticides, the air we breathe, the cigarettes we smoke, the exhaust that comes out from the cars, all these bioaccumulate in our body, and they can cause us many issues in terms of being endocrine disruptors. So some of them, to name a few, there are more than 100 disruptors, but to name a few is bisphenol A, phthalates, pesticides, and industrial pollutants called PCBs. Some of these will persist in the atmosphere and in our environment for a long time, and they will stay in the environment for decades together, and that is where they do the damage, because they not only affect this generation, but they're transgenerational, means through human reproduction, generations after can be affected. They impact the reproductive system in the female. They can cause anovulation or absence of ovulation. They can cause women to get an early menopause. They can cause polycystic ovaries, and they can diminish the quality of eggs and cause poor quality embryos during IVF. In the man, they can cause damage to the sperm. They can cause many other problems like testicular cancer, hypospadias, where the urethra is placed at a lower distance on the penis. And it can also cause cryptorchidism, that is testicular non-descent. As we know, the initial part of the embryogenesis, that is from the time that the egg is formed into an embryo till the baby is formed, there are many balances of hormones and proteins that have to happen in a particular line. These endocrine disruptors can cause an imbalance in this very sensitive environment and thereby cause damage. What is my takeaway message to you all? Women all over the world, I urge you to live healthy. Look after yourselves in body and mind. A healthy body and a healthy mind will allow you to live longer and a happier life. Thank you. Have a great day and happy Women's Day once again. I'll be happy to take questions from the audience.
The questions are already shared with you.
Yes, please.
We'll just look at them. Type it? You want me to type it?
No, just read out the question and ask her
Sure.
name and give your answer by
Sure.
speaking yourself.
Sure. Let's go to the first one. Okay. Just a moment. Is it true that this is Kumar from New Delhi? Abhishek, right? Abhishek Kumar asking this question from New Delhi. Is it true that egg freezing is still not recommended for delaying childbearing? Abhishek, I think that's a very important question. Up until a few years ago, the ASRM, that is the American Society for Reproductive Medicine, considered egg freezing as experimental. Today, in the committee opinion, say about 2 years ago, they have declared it as a viable technique of IVF, and they would recommend it whenever a woman would like to delay her childbearing. Thanks, Abhishek. On to the next question.
2 questions are there over here.
On this?
On that box.
I can only see one.
Exactly. That's what I was saying.
Okay. There is one says that which are the tests. I don't see the person's name, but there is a question which I can half read, which says which are the tests to understand the present fertility status of a couple. A very good question. First of all, what is infertility? If a couple has been trying for having a baby with regular intercourse, and if they've not conceived for 2 years, or if the couple or the woman is more than 35 years old, then if they've not conceived for 1 year, it's time to visit the specialist. Once the specialist takes a history, he or she will determine what is the cause for the infertility. Depending on the cause, he would ask for certain tests. But for a baseline, the tests that need to be done are semen testing, sperm function testing, women's hormones such as thyroid test, follicular stimulating hormone test if the woman is older. A very important test is called AMH, anti-Mullerian hormone testing, that tells us about the reservoir of the eggs. Then sugar testing is important, taking the blood pressure is important. These are the basic tests. If the doctor finds that the tubes are likely to be blocked, he or she may ask for a hysterosalpingogram or a laparoscopy along with a hysteroscopy. So I have written a book called The Complete Guide to Becoming Pregnant, and that gives you a very, very broad way at looking at what are the reasons for infertility and why one would want to do certain tests. Thank you for your question. We don't see any more questions. I think we've answered all the questions so far. Okay, there's one more question. Will there be a problem if someone gastric acidity? Okay. Will there be any problem if someone faces gastric acidity problem? Related to infertility, no. He definitely needs to consult the gastroenterologist. Well, a woman may get acidity and heartburn if she's stressed because of her husband and vice versa. So it's worthwhile looking at what's happening in their marriage. Sometimes we have couples who say they are very stressed and they're uncomfortable in the digestion. There could be reasons for that. There's one more question by Saurabh. Hello, Saurabh. Is there any CTC product for women that can be made available? CTC, oh, it says OTC. Well, I didn't understand your question too well, Saurabh. Is it an OTC for women? Is it for testing the fertility? If you're talking about testing fertility, there are kits called ovulation kits. These can show us whether a woman is ovulating at a particular time in her cycle or not. There is one question, again an interesting question from Rashmi. Hi Rashmi, it says, what is your take on designer babies? There is no such thing as designer babies. When people say that, doctor, can I have a baby with this eyes, colored eyes, or with this colored skin? Well, I always tell them that as long as you have a healthy baby, that is your designer baby. A designer baby should be one who gives happiness to the family and who is in good health. Thank you for a very interesting question. Yeah. Sandeep Sevalkar has a very scientific question, and he says, what are the baseline testing protocols for somebody with a cancer history in the family? Now, if you look at anybody's family, there will always be either a distant aunt or a close relative who suffered from cancer. Cancer today is ubiquitous. It is everywhere. One needs not get worried. However, there are some cancers which do run in families. For instance, breast cancer. Breast cancer is known to be more common in Parsis, in Sindhis, because they may carry certain mutations in their genes. Should such a thing happen, it's worthwhile to contact a geneticist, to contact an oncologist, and look at the family tree. There are also ways of checking for oncogenes, where the entire genome can be depicted and a risk for a particular cancer can be brought forth. There's a very interesting syndrome which you may have heard of, which is called Lynch syndrome. Lynch syndrome is a cluster of cancer family. Family members can have colon cancer, pancreatic cancer, thyroid cancer, ovarian cancer. And this is mostly because of certain mutations that are spread from one member to the next generation. A very interesting question indeed. Yes, I think that takes care of all the questions. Thank you very much. I had a very good afternoon on Women's Day.